Manitoba, in Winnipeg, Manitoba, Canada, and I've been asked to present a digital abstract for DDW 2011 from my study entitled Abnormal Psychometric Profiles in Patients with Suspected Sphincter of Oddi Dysfunction. This study was performed at Indiana University in 2010 during my therapeutics fellowship there. The background of this study includes that patients with sphincter of Oddi dysfunction, especially type 2 and 3, have intermediate and occasionally poor responses to ERCP and sphincterotomy as a therapy. Patients with sphincter of Oddi dysfunction have also previously been shown to have higher rates of anxiety, depression, and other comorbid psychiatric illness compared to the general population. There's a paucity of information in the literature as to whether this holds true, comparing patients with sphincter dysfunction to general patients referred for ERCP for standard indications. Therefore, the goals of our study were to assess the psychometric profiles in patients with suspected sphincter of Oddi dysfunction and to compare these to outpatients referred for standard ERCP indications. Also, we wanted to see if psychometric profile testing was predictive of the results of sphincter of Oddi manometry testing, and finally to determine if psychometric profile testing is predictive of response to endoscopic sphincterotomy in patients with abnormal sphincter of Oddi manometry. The methods of the study included prospectively enrolling consecutive patients over a 6-month period referred for ERCP at our institution. We matched cases to controls in a 2-to-1 fashion, with 2 being the control patients, i.e. non-sphincter of Oddi dysfunction patients. Patients were asked to fill out the SCL90R, a long-form standard symptom checklist, as well as the Whiteley Index 7, a very short abbreviated screening test for somatization disorder prior to their ERCP. Patients then underwent ERCP plus or minus therapies depending on standard indications. The endoscopists performing the procedures were not aware of any testing results of these patients. The Whiteley 7 index scale is shown here. The results of our study were interesting. We found, as one might expect, significant differences between patients with suspected sphincter of Oddi dysfunctions and our control patients. Using the SCL90R shown here in this table, we see significant statistical differences in almost all areas of testing, including global symptom indices, somatization indices, compulsivity, depression, sensitivity, anxiety, and hostility. All of these met statistical significance. Also, in the same table, we see significant differences being shown between cases and controls when looking for 1 positive answer on the Whiteley Index and also greater than 3 answers positive on the Whiteley Index on the far right-hand side of the table. These findings were all statistically significant. Interestingly, sphincter of Oddi patients undergoing psychometric profile testing was not predictive of whether or not they would have abnormal sphincter of Oddi manometry. Also, the SCL90R was found to have no predictive ability as to whether or not they would respond to therapy. Interestingly, the Whiteley Index score of greater than 3 out of 7 was predictive of a lack of response to therapy in patients with confirmed sphincter of Oddi dysfunction, with 84% of patients with a Whiteley Index score greater than 3 not responding to therapy at 3 months' time. This was statistically significant with a p less than 0.01. In conclusion, we found that patients with suspected sphincter of Oddi dysfunction had significantly higher levels of anxiety, hostility, depression, compulsivity, and somatization on the SCL90R, as well as global symptom indices, and that patients are also more likely to have abnormal testing results on the Whiteley Index 7 scale. Most importantly, or most interesting, we found that a Whiteley Index score of greater than 3 out of 7 was associated with a lack of response to endoscopic sphincterotomy, and it's possible that this brief pre-test assessment might be useful to screen patients prior to ERCP, thereby avoiding unnecessary procedures in patients who will not respond to therapy. Obviously, this will need to be confirmed in additional studies. Thank you.